And next up, I'm thrilled to welcome on stage Nitin Kumar, Director, Connected Care and General Manager of Elevmi from Otsuka Precision Health. And I am particularly excited about this presentation because I think caregiver support is absolutely a huge unmet need and a critical component to patients' care teams. And the work that Nitin's about to share is really cool. So welcome.
Thank you, Lauren. So everything I've shared today is actually views of my employer. Unlike what you've heard from speakers before, every word, every colon, every comma has been legal approved. So please wait for the presentation to complete, and I'll be happy to take questions. But I have to start with the patient. I think we have heard a lot about the patient voice, and this is a direct quote from an internal research which goes back to 2013, which also goes back to the testament of how long Otsuka as an organization has been committed to this space. This is a quote from a caregiver who's caring for her mom. And she says, I feel helpless, powerless like a baby. She feels helpless and acts like a baby. You don't know what to do, and you just want to scream. And that's basically not only been a North Star, a piece of motivation for us ever since we embarked on this project, because these are the unheard voices, the unseen data points in your data which does not exist. As in, guess what? As in, we have heard a lot about patients, providers, health systems, and payers today. There is not one centralized database in the industry which actually has caregiver-rich data. Because in conditions like cancer, in conditions like Alzheimer's, which I'm going to talk about in a while, caregivers have an outsized role, as in they are the ones who are not only advocating on behalf of their loved ones, they are the ones who are preparing for appointments, they are the ones who are managing bills, they are the ones who are actually having physician discussions and eventually making the decision for the drug, which you are manufacturing here today. But guess what? They do not feature in any data set, in any EHR data you look at. So how do we get to them, and how do we engage and learn more about them? Alzheimer's, and again, as in I think this is no secret, 7 million Americans living have Alzheimer's today. About 12 million Americans support some loved one who has Alzheimer's dementia. That's a burden to the nation of upwards of $400 billion. But let's talk about the caregiver burden, because again, as I said, this is an invisible force which is not only making an impact and also moving outcomes, but their voices are unheard and not seen. 7 out of 10 dementia caregivers report that coordinating care is stressful. 2 in 3 caregivers, 66%, have difficulty in finding resources. And again, these are resources not only just for their loved one, but it's also for them to get better at caring, but then also for care for themselves. The top 3 services which actually would help them, and this is again coming from the most recent research done by Alzheimer's Association, is just understanding their loved one's condition. Again, it's important that they are not the ones who are living with this condition. They are the ones who are caring for someone with the condition who cannot advocate for themselves. So when you're sitting in front of a doctor and the doctor says, hey, what's new? What's new and what's something I should know about? This is not the person who can advocate for themselves. So they need to first understand who they are advocating for, and today's caregivers are not equipped with that knowledge. They need around-the-clock support. These are caregivers who are most likely part of the sandwich generation. They are not only caring for an adult, but they're also raising children. They're also leading busy lives. They're also excelling at their careers. And they need support because the one currency they do not have is time. And most importantly, it takes a village to do this, because it's not only just one caregiver, it's actually sometimes a band of brothers and sisters, neighbors, friends, even strangers who would help you cross the road and actually get you to that vehicle which you have just booked for your loved one. It takes a village to care for someone with Alzheimer's. And that's what we have done with Elevmi. So Elevmi has been developed with a singular focus on providing support to these underwhelmed caregivers who have for long not been seen, and actually their voices have not been heard, and they are caring for a loved one with Alzheimer's, and they are desperate for support. Elevmi was soft launched in the US in October 24. It's available for free in both the app stores. It's not specific to any prescription treatment. Again, Otsuka has a prescription in Alzheimer's. It's a subcondition called agitation. But again, to use Elevmi, you don't have to be an Otsuka product. As long as you are identifying yourself as a caregiver for an Alzheimer's patient, you can get it, and you can get it for free. And of course, following Ryan's presentation, I have to mention, which is also on the slide, it was developed in partnership with Amalgam RX platform. So what does Elevmi do? So Elevmi actually does 4 things, and we hope it does those things well. Number one, it tries to help the caregiver understand what they're observing in a way that they can not only develop a habit of logging that, but most importantly, surfacing that log in front of provider conversations. And why that is important, because again, they are not the ones who are living with this condition. A lot happens between 2 appointments. A typical Alzheimer's follow-up is about 60 days. And if you think about someone who is caring for an Alzheimer's, again, having their own professional lives, children to raise, also care for the loved one, you just don't have memory, and also you just don't have that evidence which you need to now bring to an appointment to even share what's really happening on behalf of the patient. We hope that our tracker helps them do that. And we do it in 2 ways. It's the general tracking, which you would expect, from like a mechanism of a pick list. You can select a date, you can select the symptom, you can select notes. But we have actually leveraged the power of generative AI by deploying a first of its kind, a category first chatbot called L, who interfaces and interacts with the caregivers at pivotal moments, and almost as if having a conversation is able to log the same observations, which otherwise you would do it manually. And why that matters is, again, time. To do even a simple task, to open up the app, to select a date, to select an observation from a list of 50 observations, to type in a note which says that I observed this during mealtime when Beethoven was playing in the background, takes 5 minutes. You can actually do all of that in a natural conversation through text and also through voice prompts in the app itself. All of that summary gets created automatically in an interval of 7, 14, and 60 days, which can be shared directly with the provider. So hopefully the provider can not only get a quick insight of what's new, what's troublesome, what's first of its kind, and also what's the longitudinal trend since the last time I saw this patient. And most importantly, and also I should stress upon, we also have resources and support for the caregiver themselves, because it's not just about the person they are caring for, it's also about their own mental health and also their well-being. So we have tried to curate from industry sources and advocacy organizations a robust module of resource library, which again touches upon the disease state for them to understand about what's happening with the loved one, but also mental health resources so that they can also take good care of themselves. And this is, again, a typical journey, what you would expect in an app like this. I'll just anchor upon the 4 pivotal moments. After the caregiver downloads the app, they begin to engage with the AI assistant. Again, we intentionally have put that as the front and center of the app, because even before they engage through the manual tasks of navigating the app and putting in the real-world data which they want, we want them to experience the power and how naturally, through a conversation, they can get to the same task. So we hope that happens. Of course, through that, they discover content and resources. They start logging in the observations. They put in a date, and the app reminds them of the date, and then eventually it leads to a summary report, which leads to an effective conversation, because now all of that data between these steps, which could be 30, 60, even more than 90 days, is now readily available in the palm of the caregiver. So next time when the doctor asks that, hey, what's new, they are not blank, and they're also not just saying that the same. They actually have a data-driven evidence to share to the provider. And don't take my word for it. Again, this is all public information. So the app currently enjoys a 4.9 rating across both app stores. It's still early days. We are only in our 7th month since launch. It's 32 reviews. But the point I would want to kind of like anchor on is how effective it already is in the limited size of adoption what we are seeing, and it continues to grow. And also sharing for the first time in this conference, we are bringing in some utilization data, which we haven't shared publicly yet. Everything on the front row is public information. The downloads number is a multiple of that. If you have an NDA with us, we are happy to share actual download numbers. But everything in the front row is something you can get through competitive intelligence platforms. Everything in the second row is something we are sharing for the first time. And as you can see, the app is already sticky to some degree. We are seeing people use the app twice a day. Every session is about 3.5 minutes long, so about 7 minutes into the app. And again, someone would say that that's not much, but we are not a social media app. What we are giving them is a get in, do the job, and get out experience. And we hope we are doing that because about 50%, 43% to be precise, are actually creating those reports. And we know what happens after that because that leads to an effective conversation. And the last thing I want to say is actually end with the First Lady's quote, Rosalind Carter. There are only 4 kinds of people in this world. People who have been caregivers in the past, people who are caregiving right now, people who will be caregivers in future, or there are people who will themselves need to be given. And if you are a caregiver today, I'm sure a lot of us are parents and also sons and daughters caring for an adult one. The only thing I want to say is you're doing an amazing job. Thank you.
And we do have time for a couple questions, I think. I see Suhas I'm closer to.
Hey, Nitin, thanks so much for this, and big kudos to Otsuka for pushing through and getting this out. I think this is a great initiative. Question, I think from a pharma perspective, a lot of the challenges that we get when we try to even propose ideas like this coming forward is like, what would be the ROI, and we get entangled in that mess. And so how did you manage to create value capture in this when you're selling internally to the company? Because I'm assuming it's going to require investment continually, not just building the app, but creating the content, keeping it active. What was your journey there?
Thank you for the question. So I think probably I'll steal from something what we heard in the previous panel regarding why some things and some challenges are just worth doing because it's the right thing to do. Again, as in Otsuka has a rich history of going in spaces and doing things which otherwise are seen unconventional and maybe also controversial from an ROI sense, which is your question. Definitely, Otsuka, again, as I said, it's no open secret. We do have a treatment option in a subcondition for Alzheimer's. But largely, and as you saw in the data, again, this is such a huge unmet need. There are no solutions like this. And again, this is not about AI. This is not about us putting a solution like this. I think it's more about, first and foremost, understanding a stakeholder which we know exists and we have no idea of. So we are first and foremost trying to get closer to this stakeholder, really understand who these people are, how do they show up, where do they show up, and then eventually create something of value, which I'm sure the ecosystem will also recognize. And we are already seeing signals in partnerships and other requests, which we are entertaining. And again, open for business, so please reach out to us. But hopefully we will be able to demonstrate that value back very soon. Yeah.
I think we have time for one more question. Sebastian, I had one over there.
Great presentation. And I love the fact that you had metrics on user adoption. But fundamentally, the aspect of tracking the symptoms, and you take it back to the physician. See, I don't know how much value that has, because there is no drug for Alzheimer's. There is no cure for Alzheimer's today. So I don't know how that's actually helping with the caregivers. So I don't know if you have any intuition on that. And the second aspect of that is some of this information data being taken back for drug development or discovery, which could be interesting.
Yeah. Yeah. So again, and thank you for the question. So what we have actually found is, even though we are very clear in our positioning that this is for someone who is already caring for a loved one with Alzheimer's, about 15% of users who have actually onboarded on our platform are the ones who actually don't even have a formal diagnosis. So we are already seeing signs of people who are just on the fence and seeing that, you know what, I'm observing something new in my loved one. This haven't happened before. and there's some sense to it, is it Alzheimer's? I want to learn more about it. So there's definitely, and again, I don't want to use the classical funnel of like triaging someone, through a symptom, tracking, and then eventually getting to a diagnosis. Well, guess what? That is something we are definitely, working towards. But I think that this has legs on both sides, and of course, on the data which we are collecting. And also, I would mention, and I have to mention because legal asked me to say that, there is no additional data which we collect which we are not using today. So when we talk about, as an industry, about meaningful use, we definitely honor that. Again, be it like the traditions we come from being a Japanese company, we also have a opt-in, which is actually optional. There is an opt-in where we say, as part of the onboarding process, that you do not have to share your data. And if you say that, don't put my data into your data sets to analyze, you can opt out. But guess what? 72% of users who onboard are actually saying, yes, use my data because I know it's going to benefit not only me, but also people like me. Yeah.
Wonderful.
Thank you for your time.
Thank you, Nitin.